Senior clinicians from the Aboriginal Community-Controlled Health Services in Western Australia published a statement in December 2024 regarding their collective concerns about the justice system's treatment of Aboriginal children and its impact on their health. WA has the highest rate of Aboriginal children in detention of any Australian state or territory, with Aboriginal children representing around 3/4 of all children in Banksia Hill Detention Centre. The health and well-being of our children in detention has for years been neglected. Repeated failures to address signs of distress has resulted in tragedy, including deaths of children in detention. Aboriginal youth in detention in WA have the highest reported prevalence of fetal alcohol spectrum disorder in a youth justice setting in the world. 89% of children in youth detention were found to have severe neurodevelopmental impairment, which impacts a child's capacity to understand. The incarceration of children under 14 years falls short of international standards. The placement of children in Unit 18, an adult prison, breaches the United Nations Conventions on the Rights of the Child. Further to this, children in detention do not have access to the comprehensive health care that they require to address the complex physical and mental health problems that they are disproportionately affected by. The WA government has a responsibility under the National Agreement on Closing the Gap to reduce the rate of Aboriginal young people in detention by at least 30% by 2031. Urgent measures are needed to support children and their families to avoid detention, including through the prevention, early diagnosis and management of neurodevelopmental disorders. The Aboriginal Community-Controlled Health Services senior clinicians urge the WA government to raise the age of criminal responsibility to 14 years, immediately close Unit 18, invest in Aboriginal-led on-country alternatives to detention, resource Aboriginal Community-Controlled Health Services to provide culturally appropriate community child development services, invest in adequate numbers of culturally safe and appropriately qualified staff working in youth detention, partner with Aboriginal Community-Controlled Health Services to provide comprehensive primary health care directly to children in Banksia Hill Detention Centre, and improve continuity of care and clinical handover process between custodial settings and community primary health service providers.